Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic of ENT is acute and chronic inflammation of larynx. We will cover this topic in 5 sections. In the first section, we will talk about the acute infections of the larynx. And in this, we will talk about acute laryngitis, acute membranous laryngitis and epiglottitis, and also acute laryngotracheobronchitis. All these are different acute infections of the larynx or the laryngeal area. Then in the second section, we will talk about the laryngeal diphtheria. What's the diagnosis, how we diagnose laryngeal diphtheria and how we treat laryngeal diphtheria. And also we will discuss about the oedema of the larynx. Then in the third section, we will talk about chronic laryngitis without hyperplasia. And then also chronic hypertrophic laryngitis and what are the clinical features of these chronic infections or chronic laryngitis and how we examine and treat them. Then in the fourth section, we will discuss about 3 other conditions, which will be Reinke's edema, and then pachydermia laryngis, and then also atrophic laryngitis. So these are some other type of inflammation of the larynx, besides the classification just acute and chronic. Then in the fifth section, we will talk about some other inflammatory conditions which involve the larynx. And these will be tuberculosis and lupus, syphilis and leprosy, and also scleroma of the larynx and laryngeal mycosis. So these are some systemic diseases, and when they involve the larynx, these later on involve once they become widespread. So there is involvement of the larynx in these systemic diseases also. So all this will be covered in our today's topic, acute and chronic inflammation of larynx. So keep watching sqadia.com.